Hi, I'm Neil Hughes Hutchings, Senior Health and Safety Consultant at Naptham's Health and Safety. You may be thinking, where is Chris? Do not worry. After his incredible achievement of completing a marathon the other weekend, I thought I would give him a well-deserved rest. Truthfully, though, Chris kindly asked me if I would present this month's podcast. As you may recall from previous podcasts, their purpose is to act as a starter topic for further discussions within your organisation, to assist with improving compliance, and to allow workers to understand the specific topic being discussed. Before we get started, I'd like to share a recent experience of mine with you. I visited family in London over the bank holiday weekend. It has been tough for everyone over the last year and a half, and during this weekend, I felt a sense of normality returning. Grandchildren and grandparents met face to face for the first time in 18 months. Even with restrictions easing, we are not out of the woods just yet. Care providers, business owners, and operators of services in the care sector should ensure that their workplaces have adequate ventilation or air conditioning, and that their coronavirus risk assessment has been updated to reflect the restrictions easing. This can help to reduce the spread of coronavirus in the workplace. You may still choose to have one-way systems, hand sanitizing stations, and enhanced cleaning and hygiene protocols. That said, the important factor is that these control measures are recorded in your coronavirus risk assessment and that it is communicated to all workers. The Health and Safety Executive are continuing to carry out COVID spot checks on organisations. So let me begin. The question I'd like to ask this month is, do you have lone workers, and how do you supervise and control the risks they may encounter? To answer this question, we need to firstly know how lone working is defined. In simple terms, a lone worker will be a person who works by themselves. I hear you groan and say, is that it? It is the second part of the definition that defines the exact meaning of lone working, and that is that they work on their own with no direct or close supervision. Have a think for a moment or two. Who in your organisation would fit into this definition of working by themselves without direct or close supervision? Do you have delivery drivers or patient transport drivers? Perhaps security or night duty staff or cleaners? If your staff work in large care homes, they may work alone in isolated parts of it. Do they escort patients on day trips or walks or to medical appointments? Do they visit patients in their own homes? All of these may fall under the category of lone working. Why are these workers at greater risk? Well, if something was to go wrong, they may not have anyone to help them, as they are not directly or closely supervised. Therefore, it is vital that the risks that could affect lone workers are assessed and suitable and sufficient control measures are put in place. As with all risk assessments, you need to identify who could be harmed and how. This may be named individuals or a specific group of workers, such as cleaners. As these workers are not directly or closely supervised, you should have arrangements in place to train them, monitor them, and to supervise them. A system should also be implemented where they can contact or alert someone in an emergency or when things go wrong. The risks to consider within the care sector would be the risk of violence or injury and the stress, well-being, or mental health effects that isolated working may present. Also consider the risk the workplace itself poses to these workers. Those who work alone may be more vulnerable to the risk of violence, and the Health and Safety Executive defined this as any incident in which a person is abused, threatened, or assaulted in circumstances relating to their work. For these workers, you should train them in personal safety or the prevention of violence. The training should help workers to recognise situations where they may be at risk and provide them with techniques for resolving the conflict, ensuring they remain safe, or raising the alarm for assistance. Being isolated whilst working can impact on workers' mental health and can cause work-related stress. It can be difficult for lone workers to contact managers or supervisors for support or assistance. Emergency procedures should be in place, and you may decide that lone workers carry a first aid kit and receive first aid training on how to administer first aid to themselves or have access to the existing first aid facilities within the workplace. There is still a duty to monitor and keep in touch with lone workers. They also should be able to raise the alarm or be able to contact someone in the event of an emergency situation. Technological solutions can help with the communication process. They can be as simple as two-way radios or mobile phones, or more complex bespoke lone worker alarm systems. A method of communication with lone workers should be in place. The intervals at which contact is made should be agreed with the workers. You should know where your lone workers are at all times and have a system in place that allows you to know when a lone worker has finished their task or shift. By managing and controlling the risks associated with lone working, you will be able to comply with your legal duties under the Health and Safety at Work Act and the Management of Health and Safety at Work regulations. I hope the following case study will demonstrate the importance to implement a means for communication and for carrying out a lone worker risk assessment. An HSE prosecution occurred where a gamekeeper broke their pelvis after falling off a quad bike which overturned on a slope. It took 52 hours for their absence to be noticed. The gamekeeper had no means of raising the alarm. The gamekeeper unfortunately died as a result. However, the accident itself did not cause the fatality straight away. Had a system been put in place for the gamekeeper to raise the alarm, such as a mobile phone for contacting the emergency services, the gamekeeper could have summoned medical assistance. The organisation was prosecuted for failing to provide the means for communication and for not carrying out a risk assessment for a lone worker to report in at the end of a shift. I would like to thank you all for taking the time to listen to this recording and look forward to discussing further key health and safety topics with you in the coming months. Thank you and take care.